Hello, and welcome to today's webinar Africa and COVID-19, Disinfodemic. Bonjour et bienvenue au webinaire Afrique et COVID-19,
Good morning and welcome to this conference.
Communication and Media Advisor for the International Development Research Center, IDRC, at the Regional Office for Central and West Africa. Before we get started, allow me to provide some guidance on the platform to ensure that you did not miss anything from the presentations and the panel and can interact with the speakers. First, the interpretation. You will have already chosen your language of preference when you join the platform. Please note that you can change this at any time by pressing the engine button at the top right and choose the language of preference in the settings section. Second, there will be a question and answer period during the event. You can submit a question or a comment at any time. To do so, simply click on the Ask Question button on the navigation bar. The webcast player and application Slido will open up the window. Third, should you experience any technical difficulties, click the Help button, submit the problem, and you will receive immediate response via email to the publisher. Without further ado, I would like to end the discussion over to Julie Crowley, the Regional Director for Central West Africa IDRC, who will tell you a little more about the Rachel DesRosiers Alumni Award, theme of the webinar, and our distinguished guests. Julie, over to you.
Merci beaucoup, Lancelot.
Thank you very much, Lancelot. On behalf of the International Development Research Center, it's my pleasure to wish you welcome to this webinar on this series about Africa and COVID-19. Today we will be talking about disinfodemic. We have taken this term from UNESCO. UNESCO understood that disinformation and misinformation is more toxic and deadly during the COVID-19 than as compared to other subjects. The extent of this phenomenon was really related to two studies that we wanted to study the impact of disinformation and misinformation on decision taken. And therefore, we wanted to look at the impact on the decisions that are made by policymakers. These studies were conducted thanks to the support from the Rachel DesRosiers Alumni Award, and I'd like to thank those responsible for that award. The results of these studies will be presented, and then there will be a discussion with experts who will be examining what is happening on a day-to-day basis. We'll talk about the origins, the mechanisms of propagation, of spreading, and also the impact of misinformation and disinformation, as well as lessons learned and the right approaches that we would have learned throughout the process. We also are trying to look for additional research opportunities. There will be a question period, as you know, and we would like to invite you to participate actively in this session. Of course, nobody was saved, nobody rather was set apart from the pandemic. There is a huge challenge with respect to vaccination, namely in Africa. The absolute devastated impacts are deep, and the IDRC made COVID-19 one of its priorities. More than 55 million Canadian dollars were invested in research associated with COVID-19 with partners in southern countries. The emphasis was done on health, food security, education, and also the economic, relaunching the economy. And also we wanted to take advantage of artificial intelligence and taking into account inclusion, the gender equality and protection of the environment. The research that was made by the countries in development is even more important, knowing that this is one of the fundamental principles of the IDRC. It's my pleasure to introduce you to our president, Jean Labelle. As well as an international expertise in agriculture and health and environment, Dr. Labelle is also responsible for the IDRC with respect to Canada's priorities on the international development level. and he has worked with foreign countries and philanthropic organizations. Dr. Lebel, thank you very much for being with us, and over to you. There, I didn't forget to unmute myself. Thank you very much, Julie, for this introduction to our seminar today, and also for having spoken about all of my experience. I didn't even recognize myself. So hello, everybody. I'm very happy to be with you today. Thanks to our support from IDRC, you will learn more today about what's happening with respect to this subject, and the IDRC is always trying to have a better understanding of misinformation and disinformation, and also to develop strategies to respond to the situation. And without further ado, because we have with us experts who know their subject very well, I want to introduce to you Assa Anda Asanwen and Penka Marthe Bognier. They are researchers with eBase Africa, and they are also recipients of the Rachel DesRosiers Alumni Award. And Assa is an independent researcher as well, and was also a recipient of this award. And also, I wanted to mention, as Julie said, that this award is extraordinary because it comes from private funds, an association of the alumni of the IDRC, about 500 people. And personally, every year they make donations for researchers to be used by our regional researchers. There are other programs as well, but the alumni of the IDRC here are able to allow this research to be presented to you today, thanks to our webinar. And I am particularly touched by the fact that Rachel DesRosiers was an ex-employee of the IDRC, and that her partner also made a donation a few years ago, and that allows us to put forward more research. So let's talk about misinformation and disinformation, and also the infodemic.
I'm talking from Cameroon, and the COVID situation is moderate, not so worse, not so
good. Thank you very much. And Assa, where are you talking from today, and what's the situation vis-a-vis COVID at this time?
Thank you, Jean. I'm currently in Abidjan, Côte d'Ivoire, and the situation is what it is. We're all trying to deal with this new variants.
Ah, ces nouveaux variants. So,
yes, these new variants.
Assa and Penka, I'm going to lead you to present to us, the finding of your research. At the end, Patrick Ocwen will make some final remark, and I will introduce him at that moment. So why don't you start now?
Thank you for giving me the floor, Jean. Just 1 second there, please. Perfect. Thank you for giving me the floor, Jean. Welcome to everyone. It is a pleasure to have all of you here today. My name is Assa Anda Songwet. I'll be making this very important presentation today with my colleague Penka Marthe Bognier, as Jean just mentioned. So we both worked on this research project, which we will be discussing today. We will be talking about the disinfodemic around COVID-19 and its impact on evidence use in policy making and on adherence to public health measures. It is a topic that has gained increasing attention from various key stakeholders around the world over the past couple of years, including policymakers, the international donor community, development experts, and other key actors. So today we want to share some of the key results of our studies on the impact of this COVID-19 disinfodemic. Next slide, please. Thank you. So our presentation is a brief one. It is structured as follows. First, I would want to bring a few key definitions to your attention. These are definitions of terms that were at the center of our study. Secondly, I will talk about why this issue is so critical. Why are we here today attending this webinar? To talk about the infodemic or disinfodemic around COVID-19 in the particular context of Africa. What are some of the key facts and figures we need to know? We will then provide an outline of the methodology adopted in our study and how we went about coming up with our findings. Next, we will, and this is one of the main parts of the presentation, we will focus on the findings. Here, we want to bring to your attention key findings that came out of our study. And to conclude, we will share recommendations and mitigation strategies. Next slide, please. So what are the key concepts that we need to know? They all have to do with false information, misleading information. I am sure you have heard about fake news, which was made quite popular by a former US president. But let me just go through each of them, as there are key nuances which I would like to bring to your attention. First, what is misinformation? In a nutshell, misinformation is false information that is spread without a deliberate intent to deceive. So let's say you receive a WhatsApp message saying a cure was discovered for COVID-19. Whether you know if it is true or not, you share this information or this element in your family group. Now, this is false information that you're spreading, but because there's no intent to deceive or mislead, this would be considered as misinformation. Disinformation, on the other hand, is when false information is spread deliberately. So let's say here you have a world leader, for example, who comes on TV and for reasons only he knows says wearing of masks is not an effective measure in fighting the pandemic, when all scientific research has proven otherwise. This would be considered as disinformation if the false information is spread deliberately. The intention is what makes misinformation different from disinformation. Then you have fake news, of course. This is false or misleading information presented as news. You are on Facebook, for example, you come across a news article spreading false information, that would be considered as fake news. And within the context of the pandemic and our specific study, these three elements, misinformation, disinformation, and fake news, contribute to what we call the disinfodemic. That is a wave of false and misleading information about the pandemic that has multiple consequences, including on the African continent. And we will share with you some of these consequences. Next slide, please. Now, why should you and I care about this disinfodemic? Why should policymakers care? Why should the world care? Why is it an issue? Why is it such a critical issue? Let me share some key facts and figures with you. First, over 50% of individuals in a global survey said they had already come across misinformation about COVID-19. So this illustrates the magnitude of the problem. 1 in 2 people in this global survey has seen misinformation about COVID. In another survey, 3/4 of Africans reported that they were concerned about misinformation around the pandemic. Africa was the continent with the highest rates when compared to other continents. Thirdly, 1 in 2 Africans believe in conspiracy theories around the origins of COVID-19. That is 1 in 2 Africans that believe that COVID-19 was deliberately planned by foreign actors. And lastly, and this is also an important figure I would like to highlight, and you will see later on why, only 6% of Africa's population is fully vaccinated. And that is by far the lowest rate in the world. Next slide, please. So here I have a screenshot of an article which highlights the negative impact of misinformation and disinformation and why we should care. This article was published by WHO, and it is about a study which revealed how false information that consumption of alcohol could kill the virus actually led to the death of hundreds of people in the months following the outbreak. Next slide, please. Thank you. So now, how did we go about this study from a methodological perspective? First, once we received the general theme of the study, we developed our research questions. Given how vast Africa is, we focused on West and Central Africa, which is also very vast. So we decided to select 3 countries in the region, namely Cameroon, Nigeria, and Senegal, taking into account different factors. And it's also important to mention that at this time we started our study, these were also the 3 countries in Central and Western Africa with the highest number of COVID-related deaths. For data collection, we did a scoping review, which we can define as a type of literature review. For the scoping review, 11 databases we consulted, and 36 studies were analyzed. We also did surveys that were administered using a platform called Polfish, and we interviewed experts and key informants in these 3 countries. Thank you. Penka, you have the floor. Next slide, please.
Thank you, Asa. So from our research, we were able to come out with some key findings. We identified various cases of misinformation on transmission, prevention, treatment, and vaccination. So looking at the case of transmission, we had some misconception around COVID-19, where people believed that Africans were actually immune from contracting the virus and that it was kind of a Western disease. And looking at cases of misinformation on prevention, we had certain misconception where Africans believed that imported masks were actually infected with COVID-19. We had certain belief that drinking alcoholic drink will actually kill the virus. We equally had certain cases around vaccination where people believed that the vaccine was actually out to depopulate the African continent. We had other sort of misinformation where people believe COVID-19 vaccine was out to make you impotent and that some people who've taken the vaccine will probably die after 2 years. These are just some examples of the various cases of misinformation that we were able to gather around COVID-19. Next slide, please. Thank you. So we equally identify certain factors influencing the spread of misinformation around COVID-19. So we can see that crisis and conflict actually limit the trust of the public towards the government and institution, thereby leading them to create a lot of misconception around the pandemic. So we equally identify the novelty of the disease as another factor that influenced the spread of misinformation around COVID-19, because the disease being new, it creates a lot of anxiety and fear in the mind of people. We identify religion and culture, social media, lack of digital literacy, where people do not have the capacity to actually differentiate what is the right information from the wrong information on social media. Also, limited research capacity and communication capacity was another factor influencing the spread of misinformation around COVID-19 in Africa. Next slide, please. So we equally identify the various transmission mechanisms through which misinformation is actually spread. We identify offline platforms, online platforms, the various forms with which misinformation is actually spread. We identify the various languages with which misinformation is actually spread. We have official languages and unofficial languages. Equally, some key actors spreading misinformation around the COVID-19 pandemic were identified. We have local leaders, political leaders, citizens, pastors, just to name a few. So looking at the diagram, we see that with the case of Nigeria, social media is the highest transmission mechanism of misinformation. Also, we can notice that the various mechanisms with which misinformation is spread are these mechanisms that are actually easily accessible by the public and relate to their day-to-day life, as opposed to research evidence, which most often is communicated in a very complex and almost inaccessible form. Next slide, please. So on the diagram, we try to explore the trends of misinformation over time with new diseases. So we identify 4 main factors influencing the spread of misinformation and disinformation with new diseases. We realized that in the 1980s with HIV/AIDS, conspiracy theories and new diseases were the factors influencing misinformation. why in the early 2000s we realized that conflict comes in, and it's the third factor that actually influenced the rate at which misinformation and disinformation are actually spread around the various new diseases. So with the advent of COVID-19, we realized that social media steps in. So now we can identify conspiracy theory, new diseases, conflict, and social media as four key main actors influencing the spread of misinformation and the disinformation around new diseases. Next slide, please. So as impact of misinformation in the time of a global pandemic, we realize that misinformation is very dangerous as it actually limits the rate at which scientific evidence is actually taken into policy and practice. We realize that it equally affects funding values and its return on investment. So also if the fight against misinformation is not effectively tackled, there's a probability that misinformation actually becomes the way of life, without forgetting that it has a negative impact on adherence to public health measures. It is therefore crucial for governments, for development agencies, and citizens to see it as a great priority to fight the rate at which misinformation is spreading during this time of the global pandemic. Next slide, please. So from a Delphi survey and interviews, after our research, we were able to come out with mitigation strategies, both for policymakers and the citizens. So for policymakers, we identified the constructive use of social media as one key mitigation strategy, whereby the same way social media is being used to spread out the wrong information, in the same light, social media can be used to pass out the right information. So we equally identify policymakers and researchers' relationship as one key mechanism to mitigate the spread of misinformation around COVID-19. We believe that a strong relationship between policymakers and researchers will ensure that there is the effective implementation of scientific research evidence in policy decision making. So we equally have evidence barometer, which is an evidence brokering tool for policymakers that can help mitigate the rate at which misinformation affects the uptake of research evidence in the public policy decision making in this time of the global pandemic. So for citizens, we identify storytelling as one of the key mechanisms that can actually mitigate the spread of misinformation. Why? Because we believe storytelling is an easy way to get the message to the public. It is a non-confrontational approach with which we can easily communicate scientific research evidence. Equally, storytelling. For storytelling, you don't have to be a scientific savvy to understand the message that is being communicated. So we identify fact-checking platforms and also fact-checking organizations whereby citizens, the general public, will have the possibility to actually differentiate what is the right information from the wrong information that is being spread out. Also, we believe that using local languages, engaging with community leaders could help a lot in building trust between policies that have been passed out and the general public. Also, we believe that the use of implementing this into various school curriculum could actually help kids grow with the idea of actually being able to differentiate what is the right information from the wrong information. Next slide, please. So thank you for your kind attention.
Well, thank you for having done this right on the time that we had. It's fantastic. Sharp, crisp, and clear, Penka and Asa. I'm going to ask you a question. I give you about 30 seconds to think about it, each of you. What was the most rewarding in this research, and what was the most challenging? And you'll have less than 1 minute to answer me after I tell our audience that there will be a question and answer period after the comments that we receive from the panelists. You can submit those at any time. To do so, you simply click on the Slido icon at the top right on the player, and the application will open in a new window. Alors après les
So after our panelists have concluded their remarks, we'll take your questions and solicit their answers. To ask questions, just click on the Slido button and a new window will open up. You can send your questions that way. You can send your questions at any point throughout this conversation.
Question at whatever moment during the entire conversation, and we'll try to answer it through the flow of the conversation with panelists. Back to you, Penka and Asa, in 1 minute. What was the most rewarding and challenging in your research? Penka?
Yeah, so the most challenging thing in our research was to see how much it is very difficult for people to actually believe that COVID-19 is actually a reality. So from our various interviews, we had that people actually feel like COVID-19 is not real. But what was interesting is the way we were able to discuss with them and come out with certain mitigation strategies. We realized that there was a lack of trust between the citizens and the government. So the citizens did not trust government. So if we try to implement some of these mitigation strategies, it will go a long way to build that trust in such a way that the public will actually believe in certain policies that are being passed out. Thank you.
Thank you very much, Penka. Asa, à toi la parole.
Asa, the floor is yours. Thank you very much, Jean.
Challenges was actually process. With regards to the actual study, the main challenge was actually getting key informants or experts who would be able to contribute, provide their expertise and share their knowledge with regards to this specific topic. Thank you.
Good. Merci beaucoup.
Thank you very much, Penka and Asa, for your responses. These studies focused on key issues such as the incidence of disinformation and misinformation on public opinion, decision-making, how it interferes with scientific evidence, and its impact on the efficacy of our public policies in each jurisdiction and country in which we live. Thank you for sharing your research results with us. It was highly instructive. And now we are going to continue this conversation with another expert panel.
I have three panelists with us that will discuss, what they have heard. So first, let me introduce you to Josephine Apia Nyameke Sani, who is Knowledge Translation Manager with Afrobarometer. Where are you talking from, Josephine, today, and how's the COVID situation?
Hi, Jean. So I am in the United States. I'm currently in Missouri. And I think as of yesterday, they had about 5,000 new cases.
In one state?
Mm-hmm.
Very interesting. Sergio Cecchini est agent gestionnaire.
Is currently working for the World Health Organization. If I've mispronounced your name, Sergio, my apologies to you. I have phonetic pronunciation that was prepared for me. I would be tempted to say Sergio Cecchini, but I think it's Sergio Cecchini. My apologies. You are an Infodemic Management Officer and Coordinator of the Africa Infodemic Response Alliance, with the regional office of this organization. Hello, and what is the current state of affairs in terms of COVID?
I'm talking from Brussels in Belgium, in Northern Europe, where the situation is quite severe. We reported yesterday 14,000 new cases for a population of 11 million people. So I would say that is one amongst the most red European countries in terms of new infected cases. Over.
Oh la la. Thank you, Sergio. And our last panelist is Dr. Halani Gompo, who is Impact Manager with Africa Check, Africa's first independent fact-checking organization. Halani, where are you talking from and what's the COVID situation?
Yeah, thank you, John. So I am based in Johannesburg in South Africa. And quite a bit tense at the moment with obviously the announcement having come out of South Africa with the Omicron variant, that the scientists picked up on. So, and as well, reaction from the international community, where now we've got quite a number of travel bans in place. But we're also seeing that we are currently at the early stages of what we believe is our fourth wave in the country now. So cases are increasing on a daily basis now. So that's the situation with us.
Thank you very much. And I think that we have to commend South Africa for being transparent with the release of the information of this new variant. This is a gift to humanity in my book. And I think that the storyline, when we'll write the full story, will have a special place for South Africa and many South African countries for having played fair game. Kudos to the South African health authorities for making this live decision as the new variant was identified. So today, I will have a few questions for all of you as panelists. And we'll ask you first, about, is there any new finding in what you have heard related to disinformation and misinformation in these time of COVID? Are there new elements that call out to you, or some point important that you would like to add? And you will have a short period of time to do this. And I will start with Josephine to tell us in about 2 minutes, what have you heard? New things, missing things?
Well, first, thank you so much for having me on this panel. I think this is a very important topic, and I'm glad that IDRC is making these important contributions to the debate on countering misinformation. The key findings, well, though not entirely surprising, are very interesting. And some of the nuances, especially the offline channels of misinformation, are not usually highlighted in the way that you have approached it in this report. I mean, of course, social media still dominates as the channel for spreading misinformation, but the findings on churches and pastors is quite intriguing and, in fact, concerning for me. So for instance, data from Afrobarometer shows that trust in religious leaders is very high. So if churches or pastors are channels of misinformation, then I think we have a big problem. Because religious leaders are trusted so much, the risks of unsuspecting followers falling and then further disseminating the misinformation they get from them is quite high. And this results, I think, calls for serious attention. The explosion of misinformation when COVID-19 struck was probably not unexpected. That seems to be the norm during most pandemics. So on the one hand, there were rumors that this foreign disease targets only whites and affluents, and that sort of heightened the careless attitudes towards fighting the disease in Africa. And then on the other hand, we had prescriptions of various local remedies and false case counts, creating confusion and undermining public education efforts. There was also the chaos and the emergence of COVID-19, and that also did not help matters. But finally, back to the reports, the risks as clearly outlined in the reports, I think, are quite sobering. If we cannot really trust well-researched scientific evidence, then really what remains of the human species? Well, Jean said I should keep it short, so I will end it here, and then later we will delve into some Afrobarometer findings that are sort of related to this report.
Thanks, Josephine. So who communicates, the trust in science and the channel of communication, if I can paraphrase some of your observation, would that be right?
Exactly.
Thank you very much. Khalani, Africa Check is fact-checking claims on serious policy-related issue directly affecting people's lives. This, of course, includes health and COVID-19. And what are your reactions to this presentation, again, for a short 2 minutes?
Yeah, thank you, John. And I think I agree. This is an important piece of research, very relevant. for where we find ourselves now. And I think it's quite interesting. I mean, I particularly liked the graph that showed, I think from like the 1970s right up until now, and the differences in what we're seeing, and especially highlighting the role that social media is really playing, you know, in further, you know, driving misinformation in the landscape of it, and increasing its reach. Because I think particularly what was very interesting of what we observed is that, you know, misinformation and disinformation like easily crossed borders because of social media, right? And it came as an enabler for that. And it was interesting to see it highlighted there, to say how that is such a key difference, you know, in the period that we are in. So yeah, but I mean, I think just generally right now, you know, with like, there's been an evolution of the type of misinformation that we've observed with related to COVID-19. So of course, in the earlier stages, it was pretty much the conspiracy theories, you know, the origins of it, you know, to like false cures, hoaxes. But right now, of course, we find ourselves, especially in the African countries, as we try to increase the rates of vaccination. So we are dealing with a lot of vaccine-related, as highlighted as well in the presentation, vaccine-related misinformation. So as Africa Check, that's something that we're really deep in the trenches, you know, trying to tackle that form of misinformation. But yeah, those are my remarks, Jean.
Thank you very much, Lani. Sergio, c'est l'Alliance pour la...
Well, it is the fight back against disinformation in Africa that you are participating in, which is mobilizing key players on the world stage who are working hard on this issue. What did you think of the presentation? And there was a question asked of us by a member from the audience who's asking, what can we do about social media that is trying to channel this disinformation and that is flooding the world with negative ramifications? What did you think of the presentation first, and then a quick comment on that question from our audience, please. Sergio, the floor is yours. Thank you very much. Well, I think that the two research studies and presentation were highly useful. What we believe today is that knowledge about the management of the infodemic and the spread of disinformation and misinformation is a topic that isn't well known, still not well known, and not mastered by policy makers. So nowadays there is a void in terms of knowledge, a knowledge gap, if you will, a void of scientific data and understanding of the various disciplines that make up the management of an pandemic or a disinfodemic. So this is a war, and the social media platforms are new weapons that help folks around the world to wage this war in polarization. There's a war of propaganda, an ideologically driven war, such as the COVID-19 war. That is the current state of affairs. And as Aeschylus said, who's a former author of Greek tragedies, in war, it's the truth that is the first victim. And today, the fact of the matter is that there's Africa Check and other global organizations that are on the front lines in the disinfodemic and that are fighting disinformation. But unfortunately, the governments are not putting in place sufficient networks to mitigate disinformation.
So decided to have research on this front, an area of research that is so little known. but it's still based on people of goodwill leading this research. But we need to have different agencies, different organizations, different media. We need a network of organizations working together to share information, to share strategies that have worked, and also especially to share the facts, because it's important to have an approach where people want to win, but also there will be errors. There is no magic solution, because if there were, we wouldn't have this problem. But we need to share our learnings, and we need to have a common response. Thank you, Sergio. Obviously, it's very difficult to have that type of coordination, because the state can intervene, citizens can do something, and also the interest groups do something. And currently what we're seeing are a lot of different actors who are involved in this subject but don't always have the same vision.
I have so much difficulty pronouncing a guttural H, with your first name, Halani, and I hope that I'm not making too much of a massacre. As Africa Check is approaching the issue of misinformation about the pandemic, globally, what has been your contribution? As Sergio was pointing, that many needs to come in, but what is specific to Africa Check?
Yeah, so quite a number of different strategies that we've had, because of course, for us, when this came up, rightly so, as an infodemic or disinfodemic, as some label it, it wasn't business as usual, right? So we also had to respond accordingly, with a number of different strategies that we had to employ to respond to it, to the infodemic that we were seeing. Continuing with, of course, at the core of what we do with fact checking as a practice, identifying important public statements that are related to COVID-19 and using the best available evidence to publish these fact checks. But there were a number of other strategies that we had to employ, right? Like, and I think Sergio mentioned it as well, like in terms of like the strategic partnerships and collaborations that we had to engage, and for a number of different reasons, right? Because this was like a complex, at the time, complex and ever-changing health crisis that we were dealing with, and learning information, as we were going about it, right? So with the World Health Organization and CDCs in specific countries, it was important for us to be partnering, with those and collaborating together, so that we can use our platform as fact checkers to ensure that we are spreading accurate information in as far as is possible. And of course, we also make sure that we are not coming in to be enablers of any further misinformation circulating within the public sphere. So that was very important and critical for us.
And ultimately, cookie cutter approach is not optimal in those contexts. You are operating on both sides of the continent, the African continent. You have, done work in Senegal, Kenya, Nigeria, South Africa. What do you see in terms of differences between countries or region? And how does this play out in spreading, information, misinformation, and disinformation ultimately?
Yeah, so I think what was actually quite interesting is that we actually found more similarities than differences. Because first of all, it's a global issue that we were dealing with. So there were a lot of similarities across the countries. And as I mentioned previously, that you would find that when misinformation pops up in one country, it's a matter of time before the same misinformation, albeit in a slightly modified format, then appears in a different country. But I think that being said, though, there was an intersection of different kinds of misinformation that were sort of country and context specific. So for an example, if I give an example of right now what we're seeing with the vaccine, for an example, the COVID-19 vaccine, where there is an association of like institutional trust and vaccine acceptance. And I think in some countries it's better, it's been coined medical colonialism, right? Where it's because of the historical, the history that some of the countries have. So for an example, in Nigeria, where Pfizer, which is one of the companies that has released a COVID-19 vaccine, where they have a history of where there were tests that were done. I think it was about 200 children in Nigeria where there wasn't informed consent. And this was during a bacterial meningitis phase that happened in Nigeria. So that has had a ripple effect that makes it even more difficult now in tackling vaccine-related misinformation in Nigeria. But then we also saw an intersection of other issues, like, for an example, the vulnerability, which saw the spread of job scams surfacing concurrently. So you're not just dealing with COVID-19 related, the virus in itself, misinformation related to the virus itself, but it's other complex issues such as, people preying on the vulnerability of like pandemic related economic hardships. We saw, I know a lot of that in South Africa as well. But I think one thing that is glaring in a number of African countries that we're seeing is that there's a lot of false information from public figures themselves, which then make correcting misinformation quite difficult. And this is because many areas of communication and authority tend to flow downward from community leaders in African countries. So those are some of the issues that we saw surfacing.
And certainly, I think that, you point to something very important in my view from what I've heard this morning, is that we cannot separate COVID from other previous health condition or future health condition. Social economics plays a critical role. So the positioning of the activities when it comes times of fighting this infodemic is quite important and needs to be looked at, with the research lens, at least in its early days, and ongoing manner, in order to tackle the best way possible the messaging, but also measuring the impact. Thank you very much for this. Sergio, I'm back to you, and Josephine, I don't forget you. Don't worry. I'll come back to you after Sergio. The alliance that I mentioned, the African Infodemic Response Alliance that you're part of, it's the first regional network of its kind. What brought the members together, and what is the main objective and action? You speak a little bit about it, but just in a very sharp and crisp manner in 1 minute. Can you tell me?
Yeah, sure. It was launched 1 year ago by WHO African Office, based on the assumption that the battle against infodemic cannot be won acting by ourselves, by lonely agencies or actors, try each one with his own approach to fight back as individual organization or institution, but that the only chance to try to put a limit, to try to launch a counteroffensive would have been by bridging and putting together a series of different realities, a big organization like WHO that could have provided the technical expertise to validate fact-based content, fact checkers like Africa Check, to detect ongoing rumors, but also to disseminate fact-based contents, and other technical tech companies to understand how we could have used new tools, how we could have used other artificial intelligence to conduct social media listening, and then to translate into usable and shareable contents online, and to increase the partnership with anybody mobilized on this.
And you are also active on the entire continent. So, a bit similar to what I asked Khalani earlier, do you see differences, in the context of all the continents? We often talk about Francophone, Anglophone communities, but it's just two groups. There's far more many groups than this. And there's a plethora of influencers. So how do you deal with this? And you just pointed to artificial intelligence. Why don't you tell me a few things on this?
Yeah, sure. On the first part of the question, of course, to think that we could adopt a one-size-fits-all approach will lead to failure. So we work in close collaboration with the IRA members and partners, and also to the different country offices, to really try to adapt the response to the different contexts. And what we see that there are huge difference based on internet penetration, ages, religious or economical background out there. But we saw, for example, that most effective contents were those that were carried out by healthcare workers, by COVID survivors, by, let's say, micro-influencer rather than VIP celebrity style of influencers. This helps us to bring the message closer to communities. Related to artificial intelligence, it's a way to process data faster and from getting from complexity to simplicity. So being able, for example, to monitor online radio and identify which are the conversations occurring on online radio and get the snapshot of the main rumors that are discussed there without wasting too much time. Over.
Thank you very much, Sergio, for this. Josephine, you've been waiting there. And, you know, we have a question in the chat about, you know, the fact that someone says that in EU, the European Union, infodemia is presented as a fight for individual Africa. Someone is saying is a fight for freedom. In Africa, it is more limited to mistrust from the North. Is this true? And is this an accurate and relevant perspective of what's happening on the ground?
So that's an interesting question, but to answer that, I'm going to turn us to some of Afrobarometer's findings that we had on fake news and social media. Hopefully that would help answer some of the questions. So looking at the survey that we conducted in 34 African countries between 2019 and 2021, we see, for instance, that even though radio and TV remain the dominant news sources, news consumption on social media and internet is still very common. We have about half of Africans saying that they get their news from social media and the internet, at least once in a month. And this over the years is steadily increasing. Now, news consumption is more common among men, adults, young adults, urban residents, and then the highly educated than among older adults, rural residents, and those with little or no education. Now, back to the misinformation and the question about who spreads fake news the most. We see here in our data that social media users rank first. So we had about 64% of Africans saying that social media users are most likely to spread misinformation. And also we had politicians and political parties being at par with social media at the top. But we also had about half of Africans blaming the journalists and then another half blaming government officials, where only about a quarter blame activists and then interest groups for spreading false information. Now, whether or not social media is a good thing or a bad thing, we see that Africans are really clear-eyed on the positive and negative effects of social media. And so we have a large majority saying that about 9 in 10 of Africans are saying that social media helps people to be, follow current events. But the same large majority are saying that it also makes people more likely to believe false news. Now, whether or not social media should be regulated, we have about 1/3 of Africans saying that government should be able to regulate access to internet and social media, but much more, that is about half of Africans prefer unrestricted access. Now, even though we see that a lot of Africans want unrestricted access to social media, we have large majorities saying that government should be able to limit or prohibit the sharing of false news and hate speech and other contents that government finds to be problematic.
Yeah, but that's, a slippery road in some historical situation we have seen where, controlling the information becomes power, and, who makes the decision on controlling the information is as valid as a question as, the risk of having slippage with misinformation. It's a very tough question to answer. Earlier...
Also, just to add to the bits about the controlling of social media, we also had a majority of Africans saying that in times of pandemics like this, it should be okay for governments to censor the media when it comes to what, and I think that is also another way of giving undue power to the government, because then whilst hiding behind, the pretense of, ensuring that the right information goes out, they would actually be stifling one tenet that's like a very important principle needed for free and accountable governance.
Yeah,
so
thanks for this sound, observation. Now, earlier, Penka and Asa in their presentation had this, round shape map of keywords, and the size determine, their influence. And into that graph, we had, religious and traditional leader. And you mentioned this in your earlier intervention. So how is it really playing into this infodemic situation? Do they have a voice that is, accurate? Do they have a voice that is having the amplitude it needs, or is it too much amplitude? I don't know. You're the expert. Tell me about, this particular group and the influence that they have in this infodemic situation.
So from our data, and this is not just our very recent data, if you look at trends for, I think for the past decade, you realize that, so on the question on trust, that who do you trust the most? Always religious leaders and traditional leaders rank top. So Africans are more likely to trust religious and traditional leaders, somewhat or a lot. So we have about 69% of Africans saying that they trust religious leaders and 60% saying that they trust traditional leaders. And you see that these two groups of people enjoy far more trust than the president. We have just about half saying they trust the president, and local government councillors, that's just about 4 in 10, and just about 4 in 10 say they trust the parliamentarians. Now, when it comes to who people even contact when they have problems, Africans are also more likely to contact their religious leaders and their traditional leaders to discuss issues of, to discuss important problems than they are to contact other forms of leaders in society. And so that is why in my initial comments, I said that if the report that was just presented is showing that religious leaders are a very big source of misinformation, then that is quite concerning, because these are the people that majority of Africans believe the most. These are the people that majority of Africans are likely to go to when they have issues. And so these people should be armed with the right information that they can pass on. So yeah, that is just how much influence these two groups of leaders have in the African society. And so invariably, when it comes to the fight, countering misinformation.
Thank you very much, Josephine. And I will keep you on the stage here, on our virtual stage for this third round, and we're going to activate it. I see it's 9 o'clock. We have about half an hour, and I want to have some interaction with the audience also. And we have one more commentator that will come to wrap this up. But Josephine, tell us, we have talked about, your reaction to the presentation, all of you. Then we have discussed, some of the key findings and, how to address this, understand better. Now let's talk mitigation strategies. Some were presented, but in your experience, what is the most effective and the most promising mitigation strategy that we have at the face of this infodemic? I'll start with you, Josephine.
I think, again, I'm going to go back to the religious and traditional leaders. I think the very first and very important thing that we should do, if we are already not overlooking that, is to really inform them, make sure they are armed with the right information, and include them in our educational campaigns. I think they have so much influence that we wouldn't want to overlook. They would go a long way to help educate the ordinary African about the right information. So if we arm them with the right information, then we are rest assured that they would pass it on.
And
So,
this call for homegrown research, because, interacting with traditional leader, what a better way to have researcher on site, to make this development, knowing the culture, the context, the way that life is being lived in any of these country and even region, and even, at lower level in villages and, county whatsoever.
and yeah, sorry, before I go to Sergio, I'd love to share this very interesting finding we had on COVID-19. So after COVID struck, we went on a short break, and then we came back with findings from 15 countries. And one of the questions we asked was whether prayer or vaccines, so between prayer and vaccines, what is the most effective way of, preventing the spread of COVID? And we have 6 in 10 Africans saying that prayer is more effective than vaccines. And if you go to countries like Niger, Liberia, and Sudan, we have close to 9 in 10 saying that prayer is more effective than vaccines. So again, it takes me back to my point on how we really need to include religious leaders, churches, in this fight against misinformation.
Yeah. Good. Sergio, what's your reaction to, the mitigation strategy? What is your experience?
But I would, based on what Josephine has just said, and not to repeat about the importance of religious leaders, and also what she mentioned about educational campaign, and what we call media and information literacy campaign. What we have to understand that, the bulk of those who spread misinformation theories is composed by a group of, I would say, ideologically stronghold of anti-vax or spread of conspiracy theories that will never be convinced about changing their ideological mindset. What we have to work on are those who have legitimate, understandable fears or even genuine belief about worries about the vaccine. And on this, what we saw that explaining how misinformation is created, how it spreads, which are the mechanisms, in simple words. So not really to brainwash you about, think black or white, but to give you the tools to understand and to think a bit before sharing some comments. So in this way, you don't blame your receivers, you don't blame any communities, but you say, when you receive this, think that misinformation is created by step 1, step 2, step 3, or be aware that some sensationalist title may not be confirmed by the rest of the information that you're in the article. So before sharing anything that is crying at wolf or something like that, think twice. Some kind of this more conversational and educational approach resulted in less, let's say, reduced willingness or reduced ability to share misinformation content.
Thanks, Sergio. Khalani, any observation on mitigation measure, and what worked best and where are the gaps?
Yeah, so absolutely. I think echoing both what Josephine and Sergio said. So I think, first of all, latching to what Josephine mentioned, one thing that we do at Africa Check is when we engage with community leaders. So for us, it's very important that people are held accountable for, fueling any misinformation that tends to spread, right? So whatever public forum or platform a person makes a statement that can be, we find false, we engage them to go back on that same public platform and correct that information. That is very important, that there is that transparency and that visibility in how they engage. And the other thing, as Sergio mentioned, is on the media and information literacy, because in as much as sometimes we're not always successful in getting leaders, to recount some of their statements that they make, which are false. What we, however, want to do is to empower people in the public to make it difficult for when, community leaders make false statements that fuel misinformation, to make it difficult for that misinformation to be received by members of the public. And like Sergio mentioned, media and information literacy is an important tool that we use, because this is an approach that is grounded in evidence of efficacy, so we know that it works, and it proactively empowers people and makes them part of the solution in terms of combating misinformation, because they get to then actually pause and analyze information a bit more before just automatically sharing it and therefore fueling misinformation. And another thing that we have done as a mitigation strategy is to use different formats in this media literacy. So whether it's like using different formats such as graphics or podcasts, audio as well. We've received positive feedback on that, but also importantly is using local languages. So in Anglophone and Francophone, typically we normally disseminate content in English and in French, but there's a whole range of local languages that we have started to incorporate so that we meet people where they are in terms of like their understanding, because we know that language carries with it nuances that are context specific and appeal to people differently. So those are some of the mitigation strategies that we have included as well.
So, time is running by. I want to encourage our audience to send their question into the Slido application. We've got 2 questions. We pass them through the conversation. If you have any more, please don't be shy. Come in. I'll wrap this part of the conversation by blending 2 things that are closely related: the research and the capacity, the human capacity. IDRC has a mandate to develop research capacity in all this global south, and we have done it for 52 years. Communication has always been at the heart of what we do, and even our new strategy, is calling for this knowledge sharing and mobilizing this knowledge to be much more important than it has ever been. So if you are, in the shoes of the president of IDRC, oh, that's a nice job. I can tell you, it's one of the best jobs, if not the best job. What would be, your one thing in research that you think we need to do? And then, an observation, are the capacity present for implementing that research? And I'll pursue with you, Kalani.
Yeah, I mean, that's a great question. There's quite a few areas of interest. And I think, as you mentioned, one thing that I think was really of concern for us that we saw during this pandemic was the fact that corrected information tends to not actually travel as far as the original piece of misinformation that we see. So we are always actually trying to play catch up with misinformation that is spreading there. So, so tools such as incorporating artificial intelligence as sort of a bridging gap to enable and sort of increase capacity in the work that we're doing as fact-checking organizations. So that is definitely one key area of interest for us, to say, how do we look for solutions to try and really bridge that gap of saying that, how do we get factual information to try and catch up as much as possible with misinformation that spreads? And like I mentioned, that the different formats that we're using, because typically what we find is that, people don't find factual information as interesting as the rumors, as the, they're just not, it's not as interesting, right? So which is why we have started to experiment with different formats to say, how do we get people's attention on factual information and make it also equally interesting and appealing to people so that they can engage with it more as much as they easily engage with misinformation. So I think for us, that is definitely on our radar of things that we're interested in terms of like further research.
Thank you very much. Josephine, one element of research and your perspective on the capacity on the continent.
So actually, I have two research areas that I would be very much interested for.
That's the problem with the researcher. I give them one and they take two. Please.
Yeah, so for follow-ups, and it's basically a follow-up on some of the findings that we saw when it came to vaccine hesitancy. We had a lot of Africans saying that even if the vaccines were made available and the governments assured them that the vaccines were safe, they were still not going to take the vaccine. And so what I would really love for a research institution to follow up on would be whether or not people's exposure to social media has some sort of effect on their willingness or not to take the vaccine. So for instance, are people who consume news on social media more likely to be hesitant towards taking the vaccines or not? Another area that I'm pretty interested in is who is interested in taking the vaccine. We realize that older citizens are more willing to take the vaccine than younger ones, but also the rich are more likely to want to take the vaccine than the poor. So is this rumor that, COVID is a disease for the affluent? Has that got anything to do with the rich being more willing to take the vaccine than the poor, or the poor being, complacent and okay because they think, well, COVID didn't come for them? That was one of the misinformation that was being spread at the beginning. So these are two things that I would really love to have some sort of further research on, to dig deeper and find more answers to.
And on the capacity, Josephine, Halana, I've not necessarily answered that, but what would be your perspective on the capacity?
So I think from a communications point of view, and also as a researcher, it's basically finding where the issues are and sharing the findings with who really would make impact. So, I mean, for researchers who have this information, it's important to go to the drawing board and list your stakeholders, important stakeholders who would actually make an impact. So who are you engaging with the findings that you have? Are you engaging policymakers? Or are you engaging CSOs or advocates or the media? Because I don't think it's enough to just have the research sitting somewhere in your drawer. You need to share this research and engage people who would actually need this information to make impact.
Thank you very much, Josephine. Sergio, perspective, one thing on research and the capacity on the continent.
So on research, what is for us a blind spot today is how closed channels like WhatsApp or Telegram are used to spread misinformation, because it's simply impossible to conduct what we do on the other platform like social media listening to follow conversation. So you need to be part of these groups to understand what's going on there and how to counter the spread of misinformation in WhatsApp remain still a very difficult way to understand. And today, the knowledge on this also due to the nature of these closed groups, their encryption codes, and the unwillingness by the different owners to allow any kind of external entity to research of them, makes them blind spot for countering online misinformation. So our research would be definitely on how we could use WhatsApp to counter misinformation circulating on this channel. And in terms of capacity for the continent, I can say that, I mean, you have a number, and we have example here of organization platforms that have been created or that are really active on the issues of online misinformation that I don't see, for example, where I'm actually living in Europe. I don't see this kind of activist approach to defend fact-based and correct information that is not coming by, let's say, the usual suspect, which are the Ministry of Health or the institution themselves, but they are coming by civil society groups and organizations. So I think that the capacity, also the modus operandi that has been created in Africa should inspire other continents and other civil society organizations in other places to build something similar, to trigger networks of journalists. So I would try to export as much as could be possible the experience that is being conducted by groups like and by people like Josephine Lalani to other continents, because what has been created there, what is there, is not elsewhere. And if today there is a fast reactive response capacity, which is not enough, but is there, and there is reaction, you don't have these groups in Europe, for example.
Thank you, Sergio. You know, let me wrap this before we get to a closing remark by Dr. Patrick Bahakwin by asking also Asa and Penka to join in the conversation. I'm going to have the one-word answer to the following question. Pandemics, vaccine is one tool in the toolbox. The formulation of the vaccine is fundamental to help to stop the spread of the disease. In infodemic, if you had a vaccine to manufacture, you have one word to say what would be the key ingredient on it. And nobody on the 5 person that I call the 3 commentator, the 3 panelists, our 2 presenter is allowed to repeat the word of one of his colleagues. So Penka, I'll start first with you. If you had one product to put into that vaccine to combat disinformation, the infodemic, what would it be?
It will be storytelling, given our African context.
Storytelling, good. Asa, what would it be?
I would say access. If that makes sense. Yes, access.
Okay.
One word.
Thank you very much. Josephine, what it will be?
Fact-checking.
Fact-checking, the data. Yeah. Sergio.
Would be listening, know your enemy.
Oh, listening. And Khalani.
I would say pre-banking.
Pre-banking?
Pre-banking. So getting ahead of misinformation before it actually happens.
Well, you know, if I can allow myself to put one word, it would be empowering. And empowering in my lingo means that we are transferring power. And often, you know, people forget that in empowering, we have a role to play in giving away some of our power. And I think that if we are to combat this infodemic with all the ingredients that you brought, storytelling, access, fact-checking, listening, pre-banking, we have also to empower. And that, to me, would be a fantastic vaccine against infodemic that we're working on. Thank you very much for your contribution. We're going to now ask Dr. Patrick Bahakwin de eBase Africa et Africa Evidence Network de nous faire une synthèse des discussions, Patrick.
He's going to sum up the discussion, what he's heard. You're a doctor. You have global experience on health and economic questions related to health. One of the issues that we haven't discussed, but that I'd like to hear in your closing remarks, is about disinformation this disinfodemic. What are the impacts of the disinfodemic on women and girls who constitute one of the vulnerable groups in our society within the context of the particularities that we need to factor in to combat this epidemic? Patrick, the floor is yours.
Merci beaucoup, Jean, and thank you for all the great presentations and the discussions from the panelists. I have basically been smiling and really feel fulfilled with this webinar today. And at eBase, we are actually improving livelihoods through innovation and best practices, especially for the underserved populations. And you can therefore understand that with us having evidence or an innovation at the heart of what we do, misinformation is a big threat to the work, or infodemic is a big threat to the work that we do. And I would also say, with our focus on underserved populations, which Jean has rightly mentioned should be the axis of the conclusions that I will give: women, girls, indigenous populations, people with disabilities, LGBTQI, and people in rural areas. This is a very important topic. Generally, we've heard of storytelling, access, fact-checking, listening, and pre-banking as key steps moving forward. And these were all resulting from very interesting research findings that have been presented by Penka and Asa. And in essence, we want to understand the results have suggested that looking through the years, there have been key aspects that have been very critical in pandemics. If we look as far back as the 70s or the 80s, there was very little influence from the graph that was presented by Penka. But as we moved on to HIV, we discovered that this is a new disease. So new disease is the bedrock on which other factors will build around. So the next thing that came really around HIV was the conspiracy theory. Then, as we moved on to Ebola, conflicts, including global conflicts or mostly national conflicts for Ebola, were the key issues around the area. But the frenzy around infodemic was not so high. Now, the game changer from the graph, the game changer was the social media. And although there was global conflicts as well as national conflicts that brought about mistrust, but the social media was the main mechanism that was used to spread every other factor that we have seen in the previous disease. And I believe that that's a very good point that we should understand as we move forward. And we also saw that the research has opened new doors for potential research and development avenues. Like we've seen storytelling, we've seen capacity building, we've seen investigating further how we can use social media to bridge the gap between infodemics and the facts, because the infodemics are always running very fast. That was something very interesting I also gathered today. And these also, during the discussions, have brought up some questions around how governments react to research evidence versus how they react to facts. And a good question that came to my mind was, why were African governments more eager to take up, or at least some African governments, not all African governments, some African governments were more eager to take up, for example, the COVID organics that was coming from Madagascar, investing quite a lot of money in importing them versus taking up the vaccine. And what role did Pan-Africanism play in this? How do people who spread misinformation use Pan-Africanism, which is a very lovely ideology, but how do people use this because they know people will be more gullible towards that? And looking at the discussions from the panelists, very interesting discussions came up, and which should also contribute to the doors that are being opened for more investments for research and for development. Josephine, for example, highlighted the offline platforms that were critical, that she noticed that were worrisome For example, the churches and the traditional leaders, who are the people that are trusted, yet who are the people who may be at a higher chance of misinformation. Nalani, on the other end, highlighted social media and how social media works so well with mis and disinformation. And we also heard from Sergio about the knowledge on the infodemics and how the challenge with using research and capacity to actually bridge that gap. Nalani further also highlighted how this pandemic has played from the African perspective, that we are in Africa and the rest of the world is having a problem and we are in it, which is actually very different from some of the challenges, the health challenges that Africa has had, which had very little attention. For example, Lassa fever, Ebola, malaria, even HIV. We find out that science has actually been very slow to react to those ones. So I got an interesting twilight period when she mentioned that aspect of from the African continent and how it works out, and from this pandemic and how we prepare for further pandemics. We also dwelt a little bit on artificial intelligence and how that has been very useful, or how that is a good potential for us moving forward. And we also got some really interesting comments from those who, what people thought of if they were in Jean's shoes. And I think that was a very interesting angle to look at these things. Jean, I hope you got some good ideas as to what we could do moving forward. So thank you. That would be the recap I have for the presentation, for the webinar. Thank you.
Thank you very much, Patrick, for those sound observation. You know, it's not in as much as what I got in terms of guidance as what my colleagues got in terms of guidance over here. And they are the one in the trenches that make the hard work and facilitate a conversation for science to come up front. And that's what they have done with brilliance this morning. So before we close, let me first thank you all. Josephine at Afrobarometer, Halani at, oh my God, you know, I'm getting there, at Africa Check. Yes, at Africa Check. Sergio at the World Health Organization in Africa office, as well as Asa at eBay's Africa, and also Penka, and Patrick, that is equally at eBay's Africa, as well as a network that is Africa Evidence Network. So I got your affiliation all right, I hope. You were a fantastic group. I thank you for your thoroughness, your perspective, your openness, your kindness, your candor, in responding to numbers of questions. In closing, this infodemic, I think, needs also to be taught in terms of not only the health, but think about where we were 30 years ago with climate change. And look at all the steps that have been taken over a 30-year period to come to a point where, you know, now the naysayer don't have airspace. The evidence are in their face. Maybe for another meeting, we should check, you know, the parallel between the health situation and pandemics and what has happened on climate change. Why so? Because, you know, we know that we are in a global world. We know that new disease will come out. That's a fact. We don't know when, but it will be there. We cannot afford, you know, crisis like this without learning out of it in order to be more efficient and in order to make a difference in the life and livelihood of people. Over 5 million deaths on this planet is extremely powerful to say that no one is safe until everyone is safe. My plea this morning is that not only we talk about it, but that we act about it. I thank, you know, the African countries that have played fair game again and disclosing the information they had with the new variant. I plead for all around the world to make possible vaccination in real time, affordable, accessible. Whatever are the means and the tools that are required, we need to work together. It's not a game of pointing finger at each other. It's a game of getting it right and getting it right fast. Only this way we can combat infodemic. We can combat this burden of disease and of fatalities that is, extremely, extremely disruptful for the world together. So this morning, we had some ray of hope. I really enjoy our conversation. I thank you again. And back to you, Julie, pour nous amener à la fin de...
Back to you, Julie, to bring us to the end of this webinar, just on time, 9:30 Ottawa time here in Canada. Thank you, everyone. It was a great pleasure. Thank you very much, Dr. Lebel. And I would like to thank again to our presenters and our panelists today. I simply wanted to add that this webinar would not have been possible without the Alumni Award, the Rachel DesRosiers Alumni Award. So I'd like to thank the Alumni Association that allowed to be able to fund the research that was presented today. And I would like to thank also all of my colleagues at IDRC who worked to prepare this webinar: Flaubert, Lancelot, Fatimata, Yola, Mélanie, Chris, and Tando. And finally, I would like to thank all of you, all of the participants, for your interest today. We hope that this discussion was interesting, and I'd like to say that the recording of the webinar will be available soon online. You can follow our YouTube, Facebook accounts, amongst others. Julie.
Media stream. Don't forget that storytelling, access, fast-checking, listening, and pre-banking are all fundamental elements in the vaccine to combat infodemic. Thanks to you. Merci, Julie. Merci à tout le monde. Merci au CRDI.
Thank you, everyone. Thank you, everyone at IDRC. Thank you.